gets chopped off. Recording in progress. Nice. Right. Okay, I am going to welcome everybody to Family Voices Early Years event, which we're holding in November of 2021. And I'm thrilled to be joined by Trudy Mills. We're going to be talking about all things health related in the early years setting, I think, Trudy, aren't we? But first of all, I would love to ask you to introduce yourself and your role.
Thanks, Benedicte. And I'm delighted to be asked and come and talk about health and early years. Lots to talk about. My role, so I'm Trudy Mills. I'm the Executive Director for Children's Services across Surrey. So I have responsibility and accountability for children's services, physical health services and emotional health and wellbeing services.
That's a huge
yes.
Huge umbrella, isn't it?
It's big but important, so that we make sure that we integrate and you know, that we don't have a set of services that only deal with physical health and set of services that only deliver emotional health and wellbeing, and we have services that interact and work across both.
That's going to be really welcome to many families, I think. So we're obviously in this particular conversation, we're focusing on the early years. And I know that we've been in conversations over the last few months and years, and there've been a lot of things happening, I think, across the NHS and the council. I just wondered if you could give us a little bit of an idea of what developments have been happening and what the health service is looking to achieve, improve in this area.
Yeah, you're right. Lots of work has been happening. I think since I've come into Surrey, there's been a real recognition that, you know, we need to start early. We need to start our support services at the earliest opportunity for families, and by that we need to be able to identify families much earlier on in their journey, and children, so that we don't wait for children to present with difficulties. We can predict a lot in the health services now. You know, we have really good technology, we have really good pathways. So, and we've got commitment from the system, I think more importantly, Surrey Heartland system, that the early years is the most important part of the journey for children. It's where attachment happens, it's where those relationships and those bonds happen with the child and with the carer or family. And if we get that right, we set up the family well and we set up the child well, regardless of the child's difficulties or challenges. You know, we thrive to ensure that each child has the best possible opportunities available to them and their family. So we set up the First 1000 Days programme, which is a programme looking at optimising and ensuring that no child is left behind and optimising opportunities universally for children, regardless of need, across Surrey. So we've got quite a comprehensive programme of work in place around the First 1000 Days. And more importantly, we recognise that actually it goes beyond up to the First 1000 Days starts at conception and goes up to the child's age of 2. But of course, we know that early years and starting that transition from moving from being at home with your family into kind of early year settings is also a critical time for children. So we've extended and integrated the work with our early years colleagues in the local authority. So we've now got a Better Start transformation board. So we've merged the First 1000 Days and the early years work, and now we've got a Better Start programme, which looks at the whole kind of pathway from conception all the way up to 4 years of age, so that it's much more seamless. We still have a focus on the First 1000 Days, but we recognise our work doesn't stop at the age of 2. From a health perspective,
it's really interesting. When at Family Voice, when we were planning this event, we were thinking, you know, when does early years stop? And actually, in our thinking, we've kind of gone, let's go up to 6. Let's get our children into school, and then. But you're right. It's having that. There are different phases, aren't there? I wondered. You mentioned the various programs of work that you're doing within that, and I wonder, as a family, what might that look like on the ground? A lot of the time we hear about a lot of strategic work, don't we? And families will then say to us, but I can't see it. And I wonder whether it's not so much that they can't see it, but they don't know that what they're seeing is representative of what's been done at the top.
Yeah, that's, and because most of it will be subtle, and some of it would be expected in terms of, oh, do you not do that anyway? So if we think about maternity in pregnancy, we've moved to looking at how we deliver much more joined up provision in the community closer to home. So we've set up maternity hubs in Surrey. So we have a kind of one-stop provision for women when they come in. Previously, you may be booked, your pregnancy may be booked in a GP practice, and then you may have your scans in the hospital, and then you may see your midwife in the home. This is much more joined up. A maternity hub, or your community midwife teams will be in the hub. The hub may be situated in a much more multi-agency building, so there may be, they're all slightly different. So one hub may have health visitors wrapped around it, so you get to see your health visitor before you have your baby, build a relationship with your health visitor. So if there's any early issues arising in the pregnancy that we might want the health visitor to be aware of much earlier on. So there's been previous complications, or there's been, mum's been concerned about how her first pregnancy went, we can make sure she's linked in with the health visitor. And in some of the maternity hubs, we have emotional health and wellbeing teams there as well. And there was a plan that we were going to have a maternity hub delivered from a library, which would have been fantastic. It didn't work out, but that's the kind of state of the ambition that we've got, to make maternity hubs much more community focused. So that's one of the programs around maternity. During the pandemic, women were very isolated in pregnancy, and partners also equally weren't allowed into hospital. There was lots in the press about how women felt really cut off and from that kind of universal support. So through the programme, we commissioned Home Start to work with families to help reduce the kind of social isolation and the loneliness element, but also to support moms and help them interact through digital processes. So, I mean, I heard cases of mums and new babies during the pandemic. Babies hadn't met other babies until they were nearly 18 months old. And you see that lost opportunity to develop speech and language communication, social communication delays. So Home Start helped with some of those issues, helped connect people online, helped support women to go out for buggy walks with somebody else, and all obviously COVID safe, and just helped with just general day-to-day activities that in normal circumstances would be difficult, but in a pandemic, in lockdown, even more exaggerated. Other programs we're running, we've been doing small pilots in some parts of the county. So we have a small health visiting pilot around identifying children where we know they probably haven't hit the target, their developmental delay checks, so the checks that we do at 12 months and 2.5 years. They were sort of kind of ticking the boxes, they were okay, but there was something mum was saying or dad was saying or the carer was saying, well, actually, I'm not confident, there's something not quite right. So we'd put in additional visits. So we didn't ask the mum to wait for another 1.5 years before we review the child. We put in additional visits so we could just monitor, and we'd have some goal-based outcomes with that was set with mom or carer, and then we'd monitor it carefully and either referring much earlier into speech and language therapy services or not, or it would be held by the health visitor. And that's been really successful. We've picked up more babies, more toddlers than we would normally pick up just through the normal screening program.
And actually, we've had some really lovely feedback from some of those families as well. So that's really good to hear. Do you have any idea when and if that's likely to be rolled out to the rest of Surrey?
Yeah, so as part of the contract we've currently got to deliver Children and Family Health Surrey is being renewed. There are quite political and due diligence and procurement rules we have to follow. So in preparation for that, we are doing a whole transformation piece of work to look at things have changed significantly for families in Surrey. The pandemic has widened the gap in terms of health inequalities. It's also, also helped us understand for families that have got children with additional needs, that was a really difficult time, and how we moved services, some services online and digital. So we're doing a whole piece of work around early intervention and prevention, and what does that look like in the new contract. So we're hoping that we can scale that offer up, and we're currently working with commissioners to design that and look at the early intervention programme, which will include, because in some areas, so if you look at Blackpool and you look at some of the northern areas, they already incorporate 8 mandated health visiting checks. We're commissioned for 5, but with that particular pilot, we've done 8 for those. And we can already see the kind of the outcomes as you described, families feeding back saying they really valued it. So that's the plan. We just need the investment to match it. So
absolutely. So in that kind of scheme with the pilot, have you found that one of the things that we are really keen to understand, I suppose, is in that first 18 months to 2 years, families' contact with services is usually quite limited, isn't it? And it's one thing if you've got a parent who recognises that something isn't quite right or it's a little bit odd, but I remember for a start when my eldest child seemed completely fine and absolutely normal, because I had no benchmark. Normal is probably the wrong word. He's delightful, but he has autism, and that was picked up by my health visitor. Now, she initially thought it might be a bilingualism issue, but those visits were really important. I wouldn't have known to raise the question, and I suppose what I'm asking is, how can the system be more proactive in that identification of those really young children? And I think what you're describing in that pilot feels like a big part of that.
Yeah. So there's that one element in terms of the kind of the health visiting role and the screening and the family health assessments that are done in the early years. But there is also a piece of work we're doing for the MindWorks contract as well around the neurodiversity pathway.
Could I just interrupt you just one tiny bit, Trudy? Can you explain to all of our lovely parent carers what MindWorks is?
So MindWorks is the new contract that's been awarded to an alliance of partners to deliver in the old currency, the kind of CAMS services, but MindWorks is wider than specialist services. It is an alliance of voluntary organisations and mental health trusts and national charities that have come together to deliver a range of services with a real focus on early intervention and support, and it's under the umbrella of the I Thrive model, which is about early help and getting more help and getting specialist help seamlessly. So you can be in all 3 boxes or all 4 boxes, but it isn't delivered just by one organisation. It's delivered by multiple partners. And within that new model, we have relooked at how we work with children that have a range of neurodiversity presenting issues, so ranging from quite specialist and needing much more, and the comorbid, so lots of issues, not just the ASD diagnosis, but also they may have some long-term conditions and other disabilities, to the kind of mild to low level need, where it's more around requests for support and reasonable adjustments within the home and within the school environment to help that child flourish. And within the pathway, we're working with schools and we're working with families to help for schools and families understand the profiles. So what are particular presentations a child might present to you with that who has neurodiversity or has some neurodiversity traits, and then how to manage those, and supporting families with strategies on how to manage, and schools to manage children more in mainstream school. But particularly for the early years, we want to make sure we offer the same resource to early care providers as well, and to families, so that they are much more, that they're able to recognise quite quickly if a child is showing signs of either aggression or disruption or anxiety or tearful or withdrawn, that it may not it may not be attachment, it may be something completely different, and to have that lens, that neurodiversity lens, just to check that actually a child is withdrawn because of the noise and the sensory and the environment is impacting on his ability to learn, or he's not making friends, or she's not making friends because she's got this different way her brain is wired, and have you thought about neurodiversity? So there's a whole, lots of work going on there to help.
That's really good to hear. I think one of the things that we hear from parents a lot, and I think especially when their children are young, is the way that a parent can receive this is, you might go and you might say to your nursery provider, I think they might have autism, because you've done bits of Googling. And very often the conversation comes back, well, no, you can't diagnose that early, or no, you just need to go on a parenting course. And I suppose what I'm hoping is that in this new system, I would very much want to see a real reduction in parent blaming. And I suppose the other thing is that as parents, we often, by the time we're asking, we've already had some difficult experiences, usually. And when we are asking, I think, a lot of parents say, I want a diagnosis. And in hearing parents for years now, I want to reframe that and say, you're not actually asking for a diagnosis, are you? You're asking for an assessment. You're asking to better understand your child. And when you get told by the system, well, we're not going to put you on a diagnosis pathway, that can feel like a very strong rejection. When you're looking at this neurodiversity pathway, I'm also thinking, particularly in the early years, it can be much more difficult to diagnose these things. If from the nursery setting, you're starting to build up that profile of behaviors, of reactions, of sensory reactions, maybe, is that, in the system's perspective, is that a completely separate thing? And then you might in 2 years then have to go onto a pathway towards diagnosis, or is it part of a process that will move into diagnosis when or if it becomes necessary?
Yeah, that's a really good question. I mean,
long-winded, sorry.
No, we don't want to, the ambition is not to develop something to run in parallel to a diagnostic pathway. It's all one pathway. So there's a request, so for example, an early years practitioner or a parent or a carer is saying, I'm not quite sure, something's not quite right. Can somebody review what do you think, review my child? And then we would, so a request for support would come in either through the early years, through the parent, or through the school, depending on the age of the child. We would then do a sit down with the child and the parent and the early years, and look at the profiles of that child and just, well, actually, let's use this toolkit. Let's use these strategies first and see how child gets on. And then it's that whole I Thrive model. So we do the early help, the early support. No, it's not. It's not working. Small support. That's not working. Right. Well, we need to go into get some specialist support and help. So that's how it should work. It shouldn't be go back to the beginning again now and do a referral. It's just that we've tried this. And alongside that, there will be, and Nicola Dykes, a colleague in my team, has been looking into this with our digital colleagues, an MD ebook. So a digital record that will hold all of the interactions and all of the work that's happened to date with that child. So wherever that child goes in the system with the family, we're able to see what interactions have already been tried and tested. So some of the delay to getting into the diagnostic pathways is getting all of the information together and getting all of the history, and having all that on a digital record that's handheld by the parents as well, like the
Right.
It'd be an ND book, would then mean the parent can take the record wherever she goes, so, or wherever he goes, where they move out of Surrey, if they go somewhere else, they've got this record. But it should make it more seamless and more integrated in the record, and the mom has more control over kind of.
Yeah. That sounds really interesting, Trudy. In what you were saying, what really struck me was that for this to work, we need we're going to use the word seamless a lot, aren't we? A seamless collaboration between health services, but also social care and education. I'm very mindful of the fact that a lot of our families seek early help, and they get to a bit more specialist in the social care system, and then they get rejected by the children with disabilities team because they don't meet those criteria, and they find themselves in an endless loop where they go back to early help and back, and it feels really important that we acknowledge those families who actually, for whom there currently isn't a service, and I suppose find out, is that a health need, is it a social care need, and how can those two bodies actually start working properly together?
Yes, and we do have to get better at that. So I'm not to try and pretend that's perfect, because we do need to stop those handoffs between services. And I think what I really like about the iThrive model is that the system holds the child. So it's not, okay, we've done our bit now, we're going to refer you over to CWD. It's around, we've been doing this work with family. We want to bring CWD in to help us, rather than we're sending the family out of our services. It's about bringing services in to meet that family's needs, that child's needs. So it is, we're only 6 months in. So, and it is all being, as you know, co-produced, and we're working very, very actively with families and with lived experience in the room to help us make sure what we're doing is right. We've got reference groups set up so we can carry on testing and checking. It's moving in the right direction. I mean, there is a whole legacy of where we've not done as well for families as we should have done. So there's also a bit of a lot of work building confidence and trust with families that actually this work. There's a model in Portsmouth is showing really positive signs of it being successful in terms of families becoming more confident. Actually, you don't necessarily need to go down a specialist diagnostic route if we can get in, if you trust us and we can put the support in early, but also if trust us, we will move you into specialist provision as and when, or if child's needs aren't being met in the request for support or for early. So there is research and evidence to say this model will work, but it'll only work if we do it together with families, rather than try and push it onto families and say this is the model we're going to have.
Absolutely, and it is, we at Family Voice we have lots and lots of invitations to this work, which we're always very keen to be involved with. I wanted a couple of things that you talked about at the beginning, that the system, the big cheese is the nebulous cloud of knowledge, has better technologies to identify babies that might come into the world either at risk of difficulties or with things. I wondered, obviously we know that some families get antenatal diagnoses of medical, physical needs or developmental ones. For those families, a lot of the time they enter a very highly medicalized world. So, they see consultants, they never see GPs, because GPs just, no, thank you. We have, hospital records that are piles thick. A lot of those families miss out on what seems like very important universal of that health visitor, the kind of everyday community thing. I wondered how the work around this early years thing was dealing with that issue.
Yeah, so that is really, really important, because you can get sucked in as a family into the kind of specialist provision, as you say, and then miss out on the kind of universal, and that it's inclusion, isn't it? So the child should be able to access the drop-in provision that health visitors starting to sort of set back up again, family centres, etc. So we have, so in terms of how does that help us? How's digital going to help us? How's tech going to help us ensure that? I mean, we will be notified anyway through the birth notification and the 26-week pregnancy visit that health visitors do anyway. So for those children that we know there's going to be, that child's going to be born with some disability or some challenges, so babies with cleft palates we pick up, Down syndrome babies we pick up, we know about these babies before they're born, as you say. Yeah. The Surrey Care Record, which is the integrated data warehouse, has now gone live. So that means maternity data and health visiting data is visible for a health visitor. We'll be able to pull that record to see who's involved from a GP perspective, from a health visitor perspective, and I mean, you would think that's already in place, but it's you know, each organisation will have their own IT system. So this is a fantastic achievement, and we've got most of our NHS services feeding Surrey Care Record now. What I was really interested in, and I've got a meeting this week, we're putting a national bid into maternity, is how do we get red flags onto the system? So at the moment we have to go looking, so we have to know that that baby and mom are going to have some challenges when baby's born. So we have to go looking into the record to find the information on the details. With the red flag, which is we call it a kind of reasonable adjustment flag, we can put that alert on as soon as we know that potentially that child's going to have to be born with some additional needs, and then that gets flagged up. So another, I forgot to mention that premature babies as well often have developmental delay because they've got a lot of catching up to do, and it may take them a while to catch up. So how do we get an alert that the baby's premature, the baby's got some additional needs at birth that we can suspect of? How do we get that red flag in the system to remind us all that this family may need an hour to an hour and a half rather than a 45-minute slot, because we need to make some reasonable adjustments. So that's on train and that's being looked at, and we've got we're putting together a maternity bid next week to get some more national funds to help accelerate that, because it's on our roadmap to do. Yeah, digital roadmap, and it's definitely on there to do that, along with move the e-read book to electronic, as well as the red paper book to move to electronically. We've moved maternity records, now they're on smartphones and devices, and they're with women. And the same for the children's records, and then was the neurodiversity one I talked about. So once we've got all of those records digitalized, to put those early warning flags on the system should be relatively straightforward, and this additional funding will help us accelerate that progress even further. So that will help us in terms of alerting us to that fact.
Can I ask how you, we hear a lot about digital records and digitalizing a lot of things, and obviously with the pandemic, many, if not most of us, have started doing this kind of thing. I know at Family Voice, I've been really aware, without a solution yet, of those families who can't access a digital thing, either because they don't have the funds for the devices, or indeed because they have additional needs themselves and it's just not the right thing. What are the contingencies that a system like yours puts in place for those families and those women and the parents?
Yeah, so that was tested a lot for us in the pandemic as well, with particular communities, not just making the assumptions that everybody's got 3G, 4G, etc. So for the e-read book and for the maternity records that I've described, and for the neurodiversity, we will model not 100%, something around 85 to 90%, and there'll be a small percentage that will still require paper copies, easy to read copies, and copies of different languages, for example. So that's been modelled in, so that will stay. We know that we will need to maintain some paper records for the long term, because not digital won't fit, as you say, won't be perfect for everybody. But all the time, I know digitally are trying to, so I know from a Surrey perspective, Surrey County Council during the pandemic made sure that any child or any family that didn't have access to a digital pad or a phone were given out through the districts and boroughs, and schools have been doing the same. And Catherine Church, from the digital perspective, has been leading an inclusion piece of work to make sure that nobody's digitally excluded from digital programs we've been setting up. So we know, we do know about that, but also recognising that sometimes even that won't be enough and that we'll have to have paper copies.
Yeah. That's really good. I'm very aware of time passing. There was one thing that I wanted to, I think it probably kind of wraps things up quite nicely. When we have, I am, you can tell from my grey hair that I'm getting old and I'm now kind of, all of my children are now technically adults. And so it's very easy for me to see now the importance of looking to the future when you have small children. And when you have children with additional needs, that preparation for life in the big wide world is so much more complicated and needs to start much earlier. I wanted to ask you, I suppose, how within the early years work, how important is what we often call preparation for adulthood, but I try to avoid that because when I'm speaking to the parent of a 2-year-old, that just seems nonsense. One of the cohorts of parents that I'm really aware of, partly because I was one, and partly because they get forgotten very easily, are those parents whose children have a limiting condition. And when you're a parent like that, the future doesn't really exist. So for somebody to come and ask you to think about the next school or the next doctor or transition to adult services feels very, very difficult. It's very challenging because you don't know that your child is going to get there. Of course, if they do, then you have to deal with it. And I just wanted your take on how does that early years health system help families look to the future?
Yeah, it's such a tough question, isn't it? Because because there's emotions from the family's perspective and there's emotions from the kind of professional's perspective as well going into that family. But I know that the dedicated teams to our community nursing team and our continuing healthcare team always work with the families with a kind of goal-based outcome in terms of what does the family and the child want and what are their aspirations, and then the team will work with that family to make sure that they have the kind of the services that they need in place in order for that child to meet their needs and their aspirations, and we'll do that difficult conversation around managing expectations, which I think is what you're in terms of, you know, can we have those honest and transparent conversations with families so that, you know, if the child's aspiration is to be a astronaut, you know, how do we manage that and go, well, you know, you may not get on the rocket, but what's you know, what can we do in order so you get a really positive experience? Is it about a costume? Is it about a story? Is it about visiting a place? You know, to get you closer to where you would want to be. And it's managing the parents' expectations, I think, in a compassionate way. So, you know, what is the art of possible as well, and how can we link families into charities and the voluntary sector in order, who are much more creative than can be more flexible and creative and attract different funding pots for that child and family to have a kind of an experience and opportunities that we within house probably couldn't offer. But we would, right from the start, and Catherine, I know my colleague of mine is talking, talks passionately about, you know, from a health perspective, how we manage those very difficult conversations, because it's often a bereavement for a family, even the child hasn't passed, but it's the lost opportunities and ambitions as a parent you have for your child, and having that different reality to what they may have thought about would have been their reality in a different situation. So we spend a lot of time in house supporting staff to have those conversations with families as well. So we use
it's really challenging, isn't it? Because I mean, I know from a personal perspective, and I at the time I knew of a number of families where my child at the time had a life-limiting condition. He's now 18, so yay, it doesn't always turn out badly. But the conversations I at the time found the hardest were when I was being asked to look ahead to a possibility that he might be alive in 5-10 years time. And that was in some ways much harder because I'd prepared myself as much as I possibly could for the notion that he wouldn't be. And it was almost as if the professionals were telling me that I was a liar. It's a very, I think, the managing expectations thing, which I think as we grow older, we understand that phrase better. When we hear it, it's very harsh to hear, because it feels very, very negative. And I think there's a real space for professionals to identify where we are as a parent. And, you know, do I need to be told that, you know, I had an amazing hospice nurse years and years ago who, when she said goodbye, said to me that she expected to see me back in a year. And that was the most reassuring thing that I could have heard. It sounds mad, but she'd understood my fears well enough to say the right thing, to allow me to leave safely. And the fact that, you know, we had a really good outcome was wonderful, but I wasn't ready to hear it. And I think you're right. You need to manage and help parents at what can be a really, really challenging time. And it seems to me, I mean, it's an extreme version, isn't it? But when you've got a little 2-year-old with an additional need, how do you prepare for when they turn 18 and they might want to live independently or not be able to live independently at all, and all of the systems that you have to engage with? It feels really important to start having those conversations very early, but challenging at the same time.
Yeah. And I think we take on, within health, we've taken on the Time for Kids principles, which is really helping staff think about the hope and the connections, the attachments, and, you know, framing it through that lens, I think is a really nice language to be using with families in terms of, you know, particularly hope and attachment and connections. And, you know, so what, and that goes back to my first point around talking to the carer, talking to the family, talking to the child. You know, what are your hopes? What are your aspirations? How can I help you get there? And managing kind of the you know, if there are expectations to be managed and they're clear, you know, then not to shy away from that. But also if it's unknown, then there's hope, you know, we carry on.
Yeah, I think, do you know what, Trudy, that feels like a really lovely sentence to finish on, that there's hope, we carry on. Thank you so much for all of your time. I'm hopeful that we find with these things, we often get questions coming in from parents. And I think, you know, we've built a relationship where I'm sure I'll be able to keep that dialogue going. So if any of you have questions, by all means, send them our way. Thank you very much.
Thank you, Benedicte.